Hi, I'm Jonathan Esquina, and I will be your host for today's special presentation of interviews with the osteologist here on 5 Minutes. How are you doing today, Dr. Rothwell?
I'm doing good. How are you?
I'm doing great. It's a pleasure having you here.
Thanks for having me.
I'm going to ask you a few questions, if you don't mind.
I don't mind.
What vital roles do joints play in the human body?
Well, joints are the places where two bones meet and allow movement and flexibility and provide support to the human skeleton.
What are fibrous joints?
Fibrous joints are formed by fibrous tissue and no joint activity is present.
What types of fibrous joints are there?
There's syndesomes that are located by a ligament, a cord, or a band of fibrous tissue. There's gomphosis, which is located in the articulation of the tooth, and there's sutures, which are located in bones of the skull.
Now, what do all these fibrous joints have in common?
They have limited to no movement.
How has joint prosthesis improved since it was first created?
Well, in 1963, a man named Sir John Charnley performed the first total hip replacement. He made this prosthetic joint out of a metal ball on a stick and a cup-shaped polyethylene plastic socket. The socket was anchored to the pelvis with cement. Today, parts are made out of a stronger metal material. Also, joints replacements are now done everywhere around the body.
How are you doing today, Dr. Miller?
Good, what about you?
I'm doing good. It's a pleasure having you here.
Thank you. It's a pleasure being here.
I'm going to ask you a few questions if you don't mind.
Nope.
What are the types of movements for synovial joints?
There's non-axial, which is no movement on any axis. There's multi-axial, which allows movement in any plane. There's biaxial, which allows movement in two separate planes. And there's unaxial, which allows movement in only one plane.
What category of movements does each synovial joint fall in?
There's plane joint, which is not part of non-axial. They fall in socket, which is part of multi-axial. There's saddle condyloid joint, which is part of biaxial, and there's hinge pivot joint.
What are some examples of bone diseases?
Well, for one, there's bursitis, which is inflammation of the bursa, and is usually caused by a blow or friction, and it is treated with anti-inflammatory drugs into the bursa. There's also tendonitis, which is inflammation of tendon sheaths by overuse.
What are the two types of cartilaginous joints?
The two types of cartilaginous joints are synchondrosis.
Can you describe these joints?
Synchondrosis is an almost immovable joint between bones bound by a layer of cartilage. On the other hand, symphysis is a place where two bones form an almost immovable joint.
Hi, my name is Jonathan Esquina. I'm the host of 5 Minutes, and this concludes another special presentation of interviews with the osteologist. Next week, we'll be discussing various bones in the skeletal system and how it impacts everyday life and the well-being of ordinary people such as yourself. Goodbye, America, and much ado.
Can you describe these joints?
Synchondrosis.
Can you describe these joints?
Synchondrosis is almost a movable joint between bones bound by a layer of cartilage. On the other hand, symphysis is a place where two bones form an almost immovable joint of fusing.
What are the two types of cartilaginous? What are the two types of cartilaginous joints? What are the two types of cartilaginous joints?
The two types of cartilaginous joints are synchondrosis and symphysis.
Can you describe the joints?
Synchondrosis is an almost immovable joint between bones bound by
Can you describe these joints?